Hello guys, again Umar with you. Today's podcast number 5. I just decided to be the continuation of the antibiotics. Today we will talk about the drugs which affect the membrane, like the plasmic membrane, another group of antibiotics which are targeting the bacterial ribosome. Bacterial ribosome which are the portion center of the protein production. So first of all, let me begin with the drugs which attack the plasmic membrane. This group works on the plasmic membrane of the bacteria. They are narrow spectrum drugs and consist just of two drugs. First of all, polymyxin A, which is known by cholecystine. It's a narrow spectrum, works just on the gram-negative bacteria. It's given intravenously injection. It used just in necessary cases to eliminate the gram-negative bacteria, for example ESBL. Another drug, polymyxin B, is also narrow spectrum, works on the gram-negative bacteria only. It's topically worked drug in shape of creams, ointment, and drops. It's mixed with another drug to decrease the toxicity and increase the activity of the drug. Both of them making nephrotoxicity are not good to give to the pregnant. ESBL bacteria contain the gram-positive and gram-negative. So for the gram-positive we use vancomycin oftenly, and for the gram-negative bacteria ESBL is preferred to use carbapenems. That was all for the plasmic membrane attacker. Now let me talk about the drugs which attack the RNA of the bacteria ribosome. We have 4 groups of the drug that are attacking the ribosome of the bacteria. We have aminoglycosides, macrolides, tetracycline, and linocosamides, and of course some other single drugs which not belong to any group also are attacking the ribosome of the bacteria. Those drugs are targeting the ribosome of the bacteria, which leads to stop the protein production of the bacteria and stop the growth and division of the bacteria. The ribosomes consist of 2 portions, the big one which is 50 cm and the small one which is 30 cm, and each group attacks a specific portion of it. First of all, aminoglycosides. First group contains amines and considered as a polar compound. It can't eliminate the anaerobic bacteria, but it's preferred for the aerobic bacteria. It has nephro and auditory toxicity. It's active in urinary tract infection and considered as a broad spectrum drug. It works more on the gram-negative bacteria. It's not safe for pregnant and breastfeeding women. Only 2 drugs we can give, which are gentamicin and streptomycin. Group of aminoglycosides doesn't dissolve in the lipids, so it will not be absorbed in digestive system. It's given intramuscular or intravenously, and because of the bacterial wall is greasy, it can't enter to the bacteria, only will enter through oxygen dependent carriers. The drugs of the group, first of all we have gentamicin, which is known in industrial name as genticin. We have tobramycin, known as Tobrex, amikacin, which is known as amikin. They are more broad spectrum from the other drugs, and it considered for red necessary cases and will be used with drugs that attack the cellular wall like penicillin. It will be used for heart, urinary tract inflammation and pericarditis, like the bacterial pericarditis with penicillin G, and also for lung inflammations in dangerous cases with penicillin or cephalosporins, and will be used for blood prohibition. It's preferred to use gentamicin for all previous cases, and we can also change it with amikacin in case of previous drug didn't affect, and we can use tobramycin to treat pseudomonal bacteria. Another drug, streptomycin, which is known as own name streptomycin. It uses less than the another drug that I talked about before because of bacterial resistance to it, and we can use it to treat plaque, tuberculosis, TB, endocarditis, of course with penicillins. Another drug, neomycin, which is known as neomycin and neosporin. It's considered more toxicity than other group drugs. It's topically like skin creams or drops for eye, also oral tablets for disinfected stomach before intestine surgery. Another drug, paromomycin or humatin, which is known with, is considered as amoeba eliminate and just works in stomach, and it's used for simple amoeba. Let me talk about the side effect of this group and finish it. It makes nephro and auditory toxicity, and maybe it will lead to make paralysis in cases of high dose. If the group's drug works on stopping the protein production in the bacteria in the small portion of the ribosome 30 cm, which is, so it will not let the amino acids to bind and make proteins, which will lead to stop its growth and division. Second group of the drug that are attacking the ribosome are macrolides. It contains large rings and contains carbon and an ester group. It works on the large portion of the ribosome, which is 50 cm. In low dose it can stop the bacterial, and in case of high dose given it can kill the bacteria forever. It's like penicillins while It works on the gram-positive bacteria and some of the gram-negative bacteria, and it's safe for pregnancy. It's perfect for atypical bacteria. This group of drugs acts on the local irritation. In case of, if we give it intravenously, it irritates the lining of the vein and causes trachomatose phlebitis. In case of intramuscular given, it works for inflammation and abscess in the muscle, but it's safe orally. The macrolide drugs. First of all, spiramycin. It's known as rofamycin. It's active on Chalk's plasma gondii, cats, germ, and perfect for the oral infection in gums. It's used with toxoplasmosis. Now we have 3 drugs. Just make a schedule like to compare between them to be easier to remember. We have azithromycin, we have clarithromycin, we have erythromycin. The azithromycin is the best one between them. It's given 1 time daily. It's the best penetrating drug between them. It's used just for 3 days. It's a semi-industrial drug. It has less side effects and it's less inhibiting the liver enzymes, and it's work more on the atypical bacteria. The clarithromycin is a little bit worse than azithromycin. It's given 2 times daily. It's also one of the best drugs that penetrating in the body. It's given 7 to 10 days. Also semi-industrial. It has also a little bit side effects like less than azithromycin somehow. It's inhibiting some liver enzymes. It works on the gram-positive bacteria but more on the gram-negative. Erythromycin is the worst between all 3 drugs. 4 times daily is given. It's penetrating less in the body, like less than clarithromycin and azithromycin. It's given 7 to 10 days. It's a natural source drug. It has side effects more than clarithromycin and azithromycin. It's also inhibiting some liver enzymes. Also works on the gram-positive and some of the gram-negative atypical bacteria. The macrolides considered as penicillin alternative. It's used for urinary tract, especially for diphtheria and coughing, like whooping coughing, and in atypical lung inflammation and atypical bacterial inflammation, and of course for ulcer and some digestive system infection, and of course for diarrhea. The way out of the drug is through liver. Okay. Now the third group of the ribosome target drugs, we have tetracycline. It's for ring construction, of course inhibiting the protein production in the bacteria through the RNA and attacking the small portion which is 30 centimeters. It's a broad spectrum which eliminates the gram-positive and gram-negative bacteria and atypical bacteria, anaerobic also, and it marks clear on atypical bacteria. It can kill the group of primitives like amoeba and plasmodium, and some of the bacteria has resistance for it now. The tetracycline groups bind with the minerals and works as a non-absorbable complex, which lead to that we should not give it in those cases. For example, it's not given with food, milk, and acids and vitamin tablets. It will affect the bones and teeth because it's binding with the minerals that occur inside them. That's why it's not given to child under the age of 8 years, and of course it will not given to the pregnant and the breastfeeding women because it will have side effects on the baby. The drug of the group are topical irritant, same as the macrolides, which leads to, of course it's not given intravenously because it will make venous thrombosis. It's not given intramuscularly also because it's painful and will make inflammation and abscess. Best thing to give it orally, but also may make intestinal distress. Tetracycline drugs. First of all, we have drugs which are natural, like natural sources. We have chlortetracyclines, oxytetracyclines, and tetracycline itself. These 3, they have weak absorption, which is 30%, and we will use it 3 to 4 times daily. Another natural one we have democlocycline, somehow better than others in the absorption, which is 60% and 3 to 4 times daily. Another drugs of the tetracycline which are semi-industrial, we have minocycline and doxycycline. Doxycycline is known as the king of the group. It has best absorption 90 to 95%, which is it can be taken with foods, but the absorption will somehow be less. Distribution in the body for the drug is perfect, and it considered best drugs in the group, like king of the group. 1 to 2 times daily it's given. Methods of exit are either kidney or liver, so may use for people with kidney failure. It's important for acne and respiratory inflammation, especially the typical one that causes ulcer. We can use for ulcer, diarrhea, which caused by cholera, brucellosis, plaque, and malaria. For treating ulcer, we have quadruple medications and triple medication. The quadruple medications for the ulcer are tetracycline, metronidazole, bismuth, and the histamine 2 blockers, H2 blocker. The triple medications are clarithromycin, amoxicillin, and PPR. One of the atypical bacteria is called Rickettsia, we know it, which leads to make two diseases like typhus and spotted fever, which transferred by ticks. Also another one called Borrelia causes relapsing febrile disease and Lyme disease. And for all disease above, it's preferred to use the king of the group, which is doxycycline. Doxycycline, never forget it. Doxycycline is the king of the semi-industrial tetracyclines. King of the group, doxycycline. Some side effects of the group in general, let me say. They are making confusions in the digestive system. They are making weakening of the bones and teeth and may change the color of the teeth to yellow. It may cause a photosensitivity, which is sensitivity to the light, and may its toxicity go to the vestibular nerves. The excess doses cause renal and nephrotoxicity, renal and hepatotoxicity. The group 4 of the ribosome target drugs, lincosamides, is considered as an inhibitor of protein production in the bacteria, of course. It targets the big portion of the ribosome, the 50 cm one. It's active against gram-positive bacteria and anaerobic bacteria. It's considered as penicillin and macrolides alternative. It has hepatotoxicity and it may cause pseudomembranous colitis. The group are containing two drugs only, lincomycin and clindamycin. The clindamycin one is semi-industrial, it's given orally, it's more active with the gram-positive and anaerobic bacteria. It's safe for the pregnancy. It causes hepatotoxicity and pseudomembranous colitis. The another drug, lincomycin, it has a natural source given intravenously, intramuscularly. It's less active and less safe for women. It's less active and it's less safe and works on the gram-positive bacteria, the gram-positive bacteria and anaerobic bacteria, so same as clindamycin. Also, it causes hepatotoxicity, pseudomembranous colitis as clindamycin. Using the last group of the drugs that are attacking the ribosome of the bacteria, lincosamides, they are considered as penicillins and macrolides alternative for bone marrow infection, severe anaerobic infection, and acne. It's preferred to be given as intramuscular more than intravenously. It's preferred for anaerobic bacteria to use. First of all, metronidazole, which is the king of the anaerobic bacteria, and of course clindamycin in this group, and of course the second generation of the cephalosporins. Now let me talk about some drugs which affect the protein production in the bacteria and they are not belonging to any of the groups that we discussed. First drug, chloramphenicol. It's a protein inhibitor, works on the big portion, the 50 cm of the ribosome, which will just stop the protein production and will not kill the bacteria. First drug that discovered and was broad spectrum its time. It contained a huge inhibition with adults and cause inhibition of the bone marrow, which leads to inhibit the red blood cells, white blood cells, and platelets. And in child, in case of medication buildup, may make the gray baby syndrome and dilation of the blood vessels. Gray baby syndrome is typical of circulatory collapse that can occur in the premature and newborn infants and is associated with excessively high serum level of chloramphenicol. It's characterized by an ashy gray color, abdominal distension, vomiting, flaccidity, cyanosis, circulatory collapse, and death. The chloramphenicol will increase the toxicity of diabetes and epilepsy medications if we use chloramphenicol with them. It's used to treat typhoid, even it's not the best drug for typhoid, and used for treating meningitis. Again, it's not the preferred drug to it, used topically as an A drug. The second drug, which are not belonging to any groups, fusic acid, again is protein inhibitor, works on the big portion, the 50 cm one of the ribosome, used topically and activate gram-positive bacteria. It's used as cream ointment on the skin, also as eye drop for eye ointment. There is some kind of gauze dipette in it. It's available with an industrial name, which is fusidin. Third, we have mixed between two drugs. Which are quinopristine and darfopristine. They are mixed together and sold out as Sinercid or Sinercide. It's established recently, so it's expensive and considered as protein production inhibitor. Works on the big portion of the ribosome, the 50 cm one, and it's available just intravenously. And as we said, because they established it recently, so it's expensive. It works on the bacteria that are stillborn with vancomycin, or they are making resistance to the vancomycin as VRSA and VRE bacteria. Last one, we have linezolid, which is same as Sinercid, but this one has tablets and intravenously shape. That was all for today. Wish you all have a nice time. Umar was with you. Bye.